So now we're going to look at maxillary laterals. So the maxillary laterals, they're going to erupt at 8 to 9 years of age. So the maxillary laterals also, if you look at their root, with respect to the maxillary centrals, the root is a longer root. The crown is smaller than the maxillary central. So that's the first difference, is the size of the crown. So the crown is smaller. And then if we're looking at the coronal dimensions, again, since this is maxillary, we should expect IC, MD, FL. So let's go over what that means. So if we look at the cervical incisal, or I should say incisal cervical, it's going to be significantly larger than the mesial distal. And then if we were to look at the facial lingual, we're going to see that facial lingual is the smallest of all the dimensions in terms of the crown. Now when we're looking at this, the facial view, it seems like it might be slightly difficult to tell from my drawing which side is mesial and distal. Now if you look at the slope is always going to lean towards the distal. So I know that this is my distal, this is my mesial. And on the lingual view, this would be my mesial and this would be my distal. We also know that when we're talking about the maxillary lateral incisors, we're talking about tooth numbers 7 and 10. Also, comparing to the maxillary central incisors, if you look at the mesial incisal and the distal incisal edges, we're seeing that these are rounded. Now, if you remember from the maxillary centrals, in the maxillary central we saw that there was a 90-degree right here on the mesial incisal angle, and the distal incisal angle is rounded. So another difference is they're both rounded in terms of the contacts. Now if we look at where the contacts are positioned, the contact is still for the mesial at the incisal 1/3. The only difference now is in the distal, we're going to be at the middle 1/3. And from the first video in the incisor series, we remember that there are 4 developmental lobes, 3 of which come from the mamelons. So 1, 2, 3. And then the 4th lobe is going to develop into the cingulum. Now when we're comparing the cingulum to the maxillary central incisor, if you notice that the cingulum is right in line with the root axis, so it's centered with the root axis, it's not distal. So recall that the maxillary central incisor had a distal placed cingulum, while the maxillary lateral incisor, it's going to be centered. So keep that in mind. Now let's look at the height of contour. If we look at the height of contour on the maxillary centrals, the maxillary laterals, sorry about that mistake right there. We're going to see that the height of contour is pretty much going to be the same as before, where the height of contour is still going to be the cervical. So we see that the cervical third is still where the height of contour is. And that's simply because the cingulum is going to be the largest part on the lingual surface, while on the facial surface, as we're approaching the CEJ, the highest point is right there. And that goes back to the function of incisors being that they shear your food. The other thing to note is if we were to cut the root. So now if we were to make a cut directly into, or cut the root in half right here, the shape that we're going to expect to see, instead of it being triangular, now it's going to be an ovoid shape or a round shape. And that's the subtle difference also between the maxillary centrals and the laterals. If you remember that the maxillary centrals had a triangular shape in terms of the root cross section, the maxillary laterals, on the other hand, are going to have an ovoid shape. The other thing is the crown itself, if you look at it, it looks more rounded. So if we were to kind of draw this out again, we're going to see that this is rounded, and over here, it's, since this is considered the mesial incisal and distal incisal angles are considered rounded, it almost makes it seem like the crown itself is an oval shape. So that's another big thing. If you remember the maxillary centrals, the shape was more of a trapezoid and not the oval shape. And then when we think of our developmental issues, you've probably heard the name peg laterals, and peg laterals are usually referring to the maxillary laterals. So if you ever hear that name peg lateral, just know that what we're really talking about is there's a developmental change that occurs, resulting in your maxillary lateral incisors looking significantly smaller than the normal maxillary laterals. So it's termed as a peg lateral. So if you see this, like if you're looking at somebody's mouth and you kind of see this tooth that looks like this, in the place of the lateral, that's going to be what they call a peg lateral. So just keep that in mind. Well, that's the end of this session. We're going to move on to the mandibular incisors next. If you have any questions, comments, leave them below. If you like the video, please hit the thumbs up. Subscribe to the channel. And I'll see you next time.